Faith Boyce and I'm a Hack nursing student, and today I'm going to demonstrate how to give an enema and also the correct procedure for changing and cutting out a new wafer for ostomy. So here I go. Okay. Knock, knock, knock. Hi, my name is Faith Boyce and I am a nursing student from Hack. I'm washing my hands. Could you please tell me your name and date of birth? Thank you. I'm pulling the privacy curtain. Today I'm going to help you get an enema. Do you know what an enema is? And do you have any allergies? Okay, here's my enema bag. First I want to ask you some questions. When was the last time you had a bowel movement? How did it feel? What was your normal bowel pattern like? Do you have any concerns regarding your bowels? Have they been giving you any trouble lately? Okay, well we'll try to help you fix that. So first, do you mind if I look at your belly a bit? So first, I'm going to just look at the abdomen. I'm just going to assess it for color, redness, erythema, anything odd. Then I'm going to auscultate for bowel sounds. Of course, I would do it longer than that. I'm just doing it to show. And then I'm going to percuss. And I'm going to just palpate for any abnormal distensions or anything. Do you have any pain? Okay. So now I'm going to help. Is it okay if I help you get in the safest position? Because this is a good position for giving an enema. So I want you on your left side with your right leg over and this arm down in the back like this. Okay, that's perfect. Okay, I'm going to make sure there's something here, a drape or something, so we don't make a mess. Then I'm going to get my enema bag ready. I'm going to check the provider's orders, and the provider has ordered, I'm checking it off, the name and the date of birth is the same, and the provider ordered for 1,000 milliliters of large volume enema. I'm going to administer it once. So that's the orders. I checked the orders. I'm filling my enema bag with 1,000 millimeters of warm water, and I'm going to advance the water through the tubings to let the air out, and then clamp it at the end. I'm going to hang it at the appropriate level. If it's a high enema, it will be 18 inches. If it's a normal one or a lower one, it would be 12 inches or so above the anus. And I'm going to lubricate and put some lubricate on the 2 inches of the end of this. Okay, I'm going to separate the buttocks and just observe the anal area for any swelling or discharge or redness or lesions or anything like that. Okay, are you ready for me to insert the enema tubing? So I'm going to gently insert toward the direction of the umbilicus. I'm going to insert it about 3 inches and hold it there. When I reach the internal anal sphincter, I'm going to ask the patient to take a deep breath so I can get past it. And I'm just going to hold it here and release the clamp and let the fluid drain in. If the patient has any pain, I'm going to clamp it, stop it, and wait 30 seconds before I insert any more. And at a lower level, so it's going in slower. When I'm all done, I'm going to take the tubing out, dispose of it in the correct container, help my patient get into a comfortable position, and I'm going to wash my hands. And I'm going to give my patient the cowbell, and you tell me when you need to use the bathroom, because I have a bedpan right here. I'll have to get on the bedpan as soon as possible. See if you can hold it for at least 5 or 10 minutes, but let me know as soon as you have the urge to go, because it will probably be you'll probably need to go pretty bad. But we'll help you. We'll help you feel better. And so before I leave, I've washed my hands. I'm going to lower the bed to the proper level, make sure the patient's cowbell is within reach, the bed wheels are locked, patient's safe, patient's happy, and the bedpan's within reach. So that's done with the enema part of the skill. So now I'm going to do the ostomy part. So I have my ostomy. I'm going to demonstrate how to empty an ostomy bag. Here, let me come in my room, do my first 5, wash my hands, put on gloves. I'm going to demonstrate how to empty a ostomy bag. So I am going to get my collection. I'm going to put a drape there or something so it doesn't make a mess. Get my collection cup, and I'm going to carefully empty the stool unclamp, empty the stool into the collection cup, and then I'm going to wash the first couple inches of the end so it doesn't get all messy, and then I'm going to fold it again and clamp. And that will be good. And then I'm going to measure measure how much. This has 150 milliliters of light brown fluid, odorous feces in it. So yeah, it's liquid feces, but it's a odor, but it's not a C. diff odor. It's just a normal fluid feces odor. So I'm gonna measure that and dispose of it correctly, and I'm going to take my gloves off and wash my hands. And I'm going to document everything. Oh, and for the enema, I documented everything correctly as well. And then to change an ostomy wafer, I'm going to first remove carefully, like pull the skin tight and remove the old ostomy wafer from the skin. And I'm going to observe the skin for redness, edema, erythema, drainage, and approximation, which has more for wounds, but I can kind of see how the size of everything. And then I'm going to get warm water, and I won't use soap unless there's a special kind of soap that's indicated for use with ostomy wafers. I'm going to wash the skin very well. If there's any stool on the ostomy, I'm going to wipe it off with toilet paper, and then I'm going to cleanse the whole area and dry the whole area very well, and I'm going to put a little piece of gauze or something over the ostomy so it doesn't leak everywhere when I'm trying to change everything. Okay, so I've assessed for the color, I've assessed the ostomy site, and now I'm going to, this is my ostomy right here, and so I'm going to use a gauge, and I'm just going to find the one that fits. And then I'm going to cut my wafer to the correct size. First I'm going to trace. I'm going to trace, then I'm going to cut it a 1/4 to an 1/8 inch larger, because we need a little bit of space for the ostomy to expand. We don't need so much space that the skin is going to get irritated. Okay, and then I'm going to try it on and see if it works. Yes, perfect. I have a nice fit. It's just close around here with a little bit of edge, about this much edge. So it gives it a little bit of room. Then I'm going to peel off the adhesive backing and hold it, give it some pressure so that it can stick on nicely, because it's going to stay there for several days. And then after that, if it's a 2-piece ostomy bag, I'm going to take the other part and I'm going to clip it on. like the Tupperware. And then after all that, I'm just going to assess and make sure the patient's comfortable. There's no pain. There's no odd pulling or stretching. It looks normal. And then I'm going to wash my hands, and I'm going to document my procedure. And then and of course, when I leave the room, I'm making sure my bed is in the low level. I've had it at the proper working height and everything. I'm going to make sure it's in the bed level, the cowbell's within reach, the patient is comfortable and happy and everything. And then, yes, I'll be good to go. So, thank you.